After a mental health patient viciously attacked two hospital workers, state lawmakers voted to spend millions in taxpayer money on this new crisis unit. The goal was to alleviate the overload of acute mental health patients flooding emergency departments. But News 9 Investigates has learned this unit has never seen one single patient. The reason? No nurses.
As WMUR's Amy Cavino learned, the shortage is raising concerns and leading to innovative changes in the industry.
You know, mental health still needs services. I mean, there's been a little bit done, but not enough.
In August 2014, Amy Wyman and her husband Don sat down with News 9 to talk about the attack by a mentally ill patient that fractured her husband's face, caused a stroke in his brain, and left him unable to work.
So now I still think that I should go to work, but I can't.
We're warehousing these people with mental health issues at the emergency room.
Senator David Booten acted quickly after the attack at the Elliott.
This is our inpatient stabilization unit.
He wrangled $2 million into the capital budget to build this unit in a wing of the New Hampshire Hospital in Concord, the state-run publicly funded psychiatric hospital. It was completed in July 2015.
Regrettably, and to my degree of frustration and almost anger, I would say, those beds are not being used.
It's never been used, not once, even though on average 24 acute mental health patients every day seek treatment at 26 hospitals around the state. This unit was designed to alleviate the pressure in emergency departments, get mental health patients treatment more quickly, and keep staff safe. So why the delay?
We've had a nursing shortage.
With 158 beds, New Hampshire Hospital is at capacity with a waiting list every single day. Finding and keeping qualified nurses is a constant challenge. According to the hospital's CEO, at one point there were 35 vacancies here out of 117 positions. That's a 30% staffing deficit. New Hampshire Hospital isn't alone.
Every state in this country is facing a nursing shortage.
We have 250 registered nurse openings right now. It takes on average 65 days on average to fill one of those positions.
Dartmouth Hitchcock Medical Center, world-renowned, based in Lebanon, and struggling to find and keep qualified nursing staff.
How concerning is the shortage of nurses here at Dartmouth to you?
I would say it's in the top few issues that I'm dealing with really every day.
Dartmouth spends about $10 million a year on traveling nurses, bringing in staff from around the country for short stints. And now DHMC is looking outside the U.S. to recruit nurses. Chief Human Resource Officer John Malinowski says they're in talks with Puerto Rico and the Philippines.
You can't apply a traditional recruiting and retention model to this problem. We have to be flexible and creative on how we deal with this.
Last fall, Dartmouth unveiled Flex Choice, a unique staff program that puts nurses in the driver's seat.
So they tell us when they're willing to work. They're part of this big pool.
Dartmouth says it's hired 100 Flex Choice nurses so far and is also working to incentivize nurses to stay in the Dartmouth system for their entire career by expanding options to switch specialties or gain more education. Staffing levels weren't the only problem at New Hampshire Hospital. Officials discovered they were underpaying their nurses. Dr. McLeod says it was one of the best moments he's had in his 4.5 years here to announce to the entire nursing team an across-the-board pay hike of 15%. The pay adjustment is also bringing in more applications for the stabilization unit, now on track to open in July. Senator Booten hopes it's sooner than that.
My biggest fear is that we're going to have another person attacked, but this time it won't just be severe bodily harm, it will result in a death.
The Elliott Hospital here in Manchester now has a 24/7 psychiatric emergency pod staffed by psychiatric trained nurses. But hospitals around the state continue to raise the alarm about what the Elliott's chief medical officer calls a significant lack of resources to manage this particular population. Also interesting to note, the Elliott says it's not experiencing a nursing shortage, citing its desirable location and career opportunities. In Manchester, Amy Cavino, WMUR News 9.